So I want to show everybody, the reason that we're filming today is I'm always explaining kind of like how legs look with lipedema and sort of like what happens. We know that lipedema is a connective tissue disorder, so we know that the joints are already weaker than what other people have. But the interesting thing is, obviously, as you start to see the volume, there's usually more volume in the inner knee, the medial knee, and of course in this area too. But people with lipedema, they get something called valgus, which basically means the knees are coming in together. I call this an inverted Y, which you see with everyone. And it's interesting, the knee starts collapsing in here. Then what happens for people, so they do start having knee pain. A lot of times people get knee scopes pretty early on. What does happen, then you start looking at the feet here. And when you start looking at the feet, you'll see that one of two things happens. Either as your ankle joint, either this goes out and it starts actually putting a lot of pressure here, or it comes medial. She has the medial one. Actually, if you can look straight on here, you'll see kind of her foot is here and her ankle's here. It's actually pushing over. You can actually feel some of the ankle joint here. When you see that, what you'll see is as this pressure from everything is pushing down, look at this, completely flat feet. And that, we've talked about this already with her, this has happened over time. It's getting worse and worse and worse. So this is the picture you start to see with what I call classical lipedema. But that's one thing. A lot of people start thinking, they'll actually tell me they have a fat pocket here. And I always tell them this isn't fat on the ankle. It's actually your joint capsule pushing out. You'll see it more on the sides here, you'll see it here, but it's actually everything kind of collapsing on itself. So it's really painful for people. We can't completely fix the joints, but the earlier we treat this, the more volume we get off, the better chance people have of having it not progress. So I really wanted to show everybody because I think this is really, really important to see.